So, hi everyone, my name is Dr. Akram. So, I am from Sydney, Australia. So, today's webinar is for you opportunities in Australia, also in UK. So, we provide basically assistance for Australia, PLAB for UK, and USMLE for US. Okay. So even I'm going to compare also a little bit, in these three exams, then what are the process and all those things. So you can ask me any questions if you have regarding this. But I'm going to discuss in detail about the AMC exam or the process to migrate to Australia in general. Okay. So you can ask me the other exams, for example, if you want to go for USMLA or you are planning to go for the PLAB also. So you can discuss or you can ask any questions. So Academically is a Australian-based ad tech company, and we provide healthcare courses, especially the migration journey. We make that easy for all healthcare professionals like medical doctors, dentists, pharmacists, nurses, lab technicians, and so on. So in general, any medical professional want to practice in another country, so you have to complete some steps. For example, documentation process. You have to They will check your document from which university you did your degree, and you must be a registered healthcare practitioner in the home country. And then you need to write the exam and then English test. Then you can, get your registration done. The same for Australia. In case of Australia, you need to write this AMC exam, Australian Medical Council exam. Okay? So I'm going to detail about these things only. This is myself. I think I will give all these little bit intro about myself. So there are some of the faculties. Dr. Swipnil Sharma, she's an Indian doctor. She's from Pune. So she completed her MBBS and MD from Pune. And then she came to Australia. She passed this AMC exam. And currently she is working here in Sydney. Same for Dr. Udara. She's a Tamil speaker. She's from Sri Lanka. She also did the same thing. She passed this exam and she's practicing here in Sydney and others also. These are some of the faculty. We have around five faculty for this AMC preparation course. So in general, Australia provide 190,000 PR visa, permanent visa, so you can live permanently in Australia. So in case of UK, so UK you cannot got the PR visa first. You have to go there and work for 3 years. Then only you can apply your PR and then citizenship. So it might take around in general 6 to 10 years to become the UK citizen, but in Australia it can be from day one onwards. Even you can get the PR visa in Australia. So Australia is highly recommended in that case. So if you are planning to work, you want to earn the money, in that case you can choose AMC Australia and apply for UK. But if you are thinking to go for PG, in that case might be the UK can be the good option for you. So Australia has provide 10,000 job vacancies currently available. A lot of jobs are available, and salary is very very high as compared to US and UK in Australia. Okay, the Australia only country once you pass this Part One exam from home country, you can work in Australia. You cannot work in UK after PLAB one or USMLE one, uh, but in Australia you can work. So these are some of the facts about this Australia. So in general, in Australia, once you pass Part 1 AMC exam, Australian Medical Council Part 1 exams, if you pass, then you are eligible to work as a GMO, Junior Medical Officer or Resident Medical Officer. And simultaneously, you can prepare yourself for Part 2, this is the clinical exam or OSCE exam. And while you are working there, your salary is going to be around 4 to 5 lakh Indian rupees per month. You can earn easily, and the salary also very little bit. So if you are working Monday to Friday for 5 days, this is the normal salary. But if you are working in Saturdays, you are going to get 1.5x. Or after hours means if you are working in a hospital after 7 p.m. For example, if you have a night shift, they will pay you 1.5x. Or if you are working in Sunday or other public holidays, you will get that 2x salary. for that day whenever you are working in general in Australia. So in Australia, how much they can earn as a GP? I'm not talking about the specialists like surgeons or the pediatricians or other specialties. They are earning a lot. For example, the highest earning in Australia, the salary highest for the neurosurgeon, they make around 600,000 Australian dollar, or I can say around 3.3 CR per year salary for them. And surgeons make around 400 to 600,000 per year on an average. But if you are just a MBBS and you don't want to take much, uh, I can say, risk in your life, and you want to just peaceful life, basically is a good word I can say. You just want to work Monday to Friday for 5 days, and you want to enjoy your life. In that case, you can become a GP after MBBS, and in that case, still you can earn a lot of money. So maximum per day patient, you can see 60 patient by law in Australia. You cannot see more than 60 patient in Australia per day. Okay. So if you are seeing the 60 patient, the government will pay you 21 to $250 per patient. Okay. So this is the vary for you, like based on the patient condition and what the procedure you are performing, all those things. So on an average, if you are seeing for 40 patient per day, if you are seeing for 5 days, still you can earn a lot. And this is I'm talking about the you have to work for 5 days. Okay, you are working 38 to 40 hours weekly for 5 days, 8 hours per day. You are working for 5 days. Still, you can make at least 12 to 13 lakh per month easily in Australia in general. Okay, so this is the little bit about the salary. But while you completed your part one, still this is a normal or average salaries in Australia. You can see here. And the education for kids are free in Australia. So your dependents are allowed to work full time in Australia, first of all. And they also the kids education is free, and healthcare access also free in Australia. In case of US, you need to buy the insurance while you are living in US, but in Australia, no need to buy. There's a universal health coverage here. And professional development, for example, you want to update or upgrade yourself, some CPD points and all those things, or you want to attend any workshop, or you want to attend any conference or something. So they highly encourage, especially for the young doctors, to go and get new skills. So they will pay all these bills for you. And work-life balance, as I mentioned, you need to work around 40 hours weekly, 8 hours per day. And while you are doing internship, you already know currently you are working how many hours currently. Some of them in India, they work like 48 hours, 72 hours. Sometimes they don't need to go back to their home, right? So here is not like that. You just need to work for 8 hours, and then you need to go to back to your home. And career opportunities here, uh, basically high demand for medical professionals. So you will get a PR visa, fast track PR visa, and quality of life obviously very high, and high potential of earning. So these are some of the factors you need to think about when you are getting to Australia. So these are the steps you need to take in order to get registration done in Australia. So first step, in simple words, I can say this is called document verification. So we will do academically, we'll do this process for you. So no need to worry. This is a very easy process. And the important thing I can compare here now for UK and US also. Okay. So for this process might take 2 weeks in Australia. Okay. It's very, very a simple process for you. In UK also and US also not take much time. But while you are booking the exam, so in this exam, AMC, this is a monthly exam. Whenever you are ready, you can write this exam. But in case of UK, you need to uh, there is a long queue basically. It might take 12 to 18 months to get the exam date for you. So you have to wait, it's a long time to go for lab UK. And US also similarly. not that much long, but still you need to wait there. But there is a lot of dates are available for USMLE. So USMLE and AMC easily you can get the date, but PLAB to get a date very difficult. So this is a AMC MCQ exams, and this is an online exam. There is so many centers, including the Chennai. We have the center, so you can write this exam in Chennai. And once you pass this exam, then you will get the limited registration. And for this, we will provide you the 4-month coaching. Okay, we'll provide you the 4-month coaching for AMC Part 1. We'll provide you the live sessions, live classes from Sydney, and we'll give you some study material plus the mock test, lot of practice questions from previous year question papers. So 4 months, I can say, good time to pass this exam. So if you can give per day 4 to 5 hours, you can crack this exam in 4 months. And passing rate for this exam is very high. I can say around, I can say more than your NEET PG in India. So around 60 to 70% students pass in their first attempt this AMC Part 1 exam. And then you need to pass this English test as well. We will also provide you the coaching for this. So OET and PTE highly recommended exam as compared to IELTS. Okay, and then you are eligible to apply jobs in Australia as a JMO, junior medical officer, or resident medical officer. Or some student they come on a study visa on non-clinical course, for example, Master of Public Health or Healthcare Management, those kind of course, and then they go for this AMC Part 2. So many students basically always ask, this is AMC Part 2 a little bit tough exam. So is there any alternate for this? Yes, there's an alternate called WBA program, work-based assessment. So you can go WBA program, no need to write AMC Part 2. And once you complete this process, then you can get the full registration. So WBA, the passing rate is 99%. Okay, means that minimum 4 departments you need to choose. For example, like surgery, and then internal medicine, and option gynae, and all those subjects you have to choose. And each department you have to be rotated for 2 months. And those 2 months, there is someone is your a mentor for you. They will give you, and also there is all the other staff. They will give you the feedback about you, and they will get you need to give an interview kind of thing, sort of things. So very easier for you to pass this exam. So I can say you will pass definitely 100% for this WBA program. If you not done anything wrong or any like blunder in the hospital, someone is like unhappy with your, services, someone is complaining against your, those kind of things. Otherwise, no problem. You will pass in this WBA. And then you will get the full registration. Now, if you want to do PG in Australia, okay, and then you can basically you have to do after full registration you have to go for 1 year again for residency. Then after that you have to choose which specialization you want to go. So specialization vary like subject to subject, so around 3 to 6 years it might take in Australia. But while you are working you are getting paid, so you are not doing free of cost for just while you are doing PG in Australia. Okay. And this is work-based assessment, WBA. Again, this is government hire always. So they are just asking, you just need to pass AMC Part 1 and you can apply. So Western Australia currently is hiring for this program. So those are completed their this AMC Part 1, they can apply. Here are some of the basically the link. I think Abdul can show you the a lot of jobs are currently available. Maybe one link I can show you maybe here as well. So this is junior doctor training program. So you can see here a lot of jobs are available. This is a government website, is government of Australia. Okay, this is federal government basically, and you can see here a lot of agencies they are hiring. For example, you are in Pondicherry or Tamil Nadu. Tamil Nadu government has to hire for their own hospitals, and Pondicherry hires separately. Andhra Pradesh have separately. Right? So each state have their own government agency to hire these healthcare professionals. Here also a similar steps we can say. So each state have their own agency and they hire a lot of people. So you can see Victoria hiring, New South Wales is the state, and this is ACT is Canberra is so there are a lot of jobs you can find here, and all those things. You can email them, if you have any inquiry, and you also there is a separate fund is there, for you to support. So a lot of information basically, you can have a look. So, but only you can do these things once you pass this AMC MCQ based exam, part one exam. And AMC exam, they conduct 10 times yearly. So very easier for you to get, whenever you are ready, you can write this exam, except December or January. Whenever you're ready, you can write. But PLAB, you have to wait for the date. Very difficult to get that date. And here we are providing basically coaching for PLAB also, USMLE also, and EMC also. So I'm not something, so I'm not promoting like one course to another. Whatever you want, you can. But just I'm just talk to you the fact regarding these exams. And there is a 15 exam centers currently in India. Chennai also have the exam centers, so you can write this exam there. And English, you can go for OET and PT. These are the easier exam. But if you are comfortable, you think that the IELTS is easier for you, you can go IELTS easier for you. So in general, if your score is 6 in IELTS, so 7 you can get in PT and OET easily. And we need your assessment degree, transcript, work experience, not mandatory. If you have any, you can show valid passport and government ID proof and passport photograph, registration, all these documents required to submit this. And this is basically a 3-hour exam, and they will give you for 150 questions, and around 50% you need to score in order to pass the exam. But in case of PLAB, at least you need to score 60 to 62%. Okay, and there is no negative marking, so you have to attend all 150 questions. If you left to attend any questions, your paper is not going to evaluate it. Okay, so you have to attend all these questions. We will provide you coaching for 4 months, and 4 months is enough to complete the syllabus and to pass this exam. And once you complete this process, then you are eligible to work 191, 186, 189 visa, and you have some work visa also you are eligible, and these are the regional sponsored visa. Here are some of the media coverage about the academically, and these are the things. Yeah, the other fees, I think Abdul can give you the more detail. And we have a financial partner, so we also can help you in your loan if you want. 3 months, 6 months, 9 months, or 12 months without paying any interest, you can pay. Yeah, so that's all from my side. But if you want me to give on more detail regarding the PLAB or USMLE, so I can open another PPT, or maybe you can ask Q&A. Any questions you have, any doubt?
Yes, our presentation is over. If you need, yes, sir.
Yes, you can talk.
So if you have any questions regarding this, the AMC or PLAB or USMLE, you can just interact with Dr. Akram. I can give the right. Any doubts regarding this process? Yes. Any doubts, brother? Any doubts?
If I finish a residency program from Australia, where all will that be valid? Like, if I finish my residency in Australia, so where else can I practice in the world with that degree and fellowship?
First of all, if you are in any high income country, So the most likely you will be, acceptable in that particular country, and Gulf countries also you can practice. Even India also you can practice. So this is basically US, Canada, or UK in Australia. So if you are doing PG here, is also applicable in India. This is valid in India. Gulf country also you can practice. Even from Australia, you can also practice in New Zealand as well, and Canada also.
Gulf countries usually have a higher pay scale for USMLE graduates, like
No, they are
residents
basically
from the United
in
States.
general
So
in general Gulf countries people they see the passport. So if your passport from any other country, maybe US, UK, Australia, obviously they will pay 3 to 4 times higher salary as compared to Indian passport. Okay, and same for if you are have the training from Australia, US, or UK, or Canada, definitely they will pay you double.
so is it the same amount if I do a residency in Australia?
Your voice is breaking, so I'm not able to understand. Can you please, Abdul, can you please repeat?
If I
Doctor, your voice is breaking, so I'm not able to hear anything. Or maybe Abdul, you can just type the question so I can read and give the answer.
Exactly. If I
Siva, are you able to hear
if I
this?
do a residency from Australia and then go and practice in a Gulf country, will I be paid at the same scale as someone who has done their residency from the US?
Yes, I told you even more than that. Australia is not less than US. US, even if you go UK also, you will get the same pay. UK, Australia, US, these are the high income countries, the same standard they follow. And you will getting paid around the same.
Then why would anyone opt for the USMLE when it's significantly tougher, but you're saying the advantage is the same as an AMC?
Hmm. Yes, many people don't know about AMC. We have more than 150 students enrolled with us within last 4 months. So we are working in India. People actually they are aware only USMLE and flag. Don't know about the Australia. That's why we are just trying to create the awareness regarding this AMC concept. I think your voice little bit.
Okay, thank you so much.
So thank you, sir.
Okay, thank you.
So I'll handle the students, sir. From your end, there's no one to support. Most colleges there are support. I had to
Thank you, Tawsif sir. We can wind up, right?